any type of ACL graft can be used for any type of patient. Is this fact or fiction?
To some extent, that is true, um, because the outcome of surgery is often more dependent on um, good surgical technique, that's placing the graft in the right position or anatomical position. And a lot of patients will do well regardless of what type of graft is chosen, but there are exceptions to that. And I'll name several of them. One is with patellar tendon. Because of where the graft is taken from in front of the knee, studies have actually shown there's a higher risk of developing anterior knee pain, especially with kneeling and squatting with this type of graft. So people who are involved in occupations involving a lot of kneeling and squatting, such as those who install floors and roofs, may want to avoid this graft, as well as certain sporting activities such as being a bat catcher in baseball where you're squatting all the time. You may want to avoid this graft. Or if you're a wrestler down on the mat a lot of the time, you may want to also avoid this graft. With regard to the hamstring tendon graft, there are some drawbacks. And for example, studies have shown that there's a slightly higher risk of graft re-tear with hamstring autograft versus patellar tendon autograft, especially in very highly competitive contact sports such as rugby, soccer, and football. Although the difference is on the the order of 1 to 2%, but that could make a difference for the individual patient. As well with hamstring autograft, although most people get their knee flexion strength back after hamstring autograft use, there's a significant number that lose some strength of deep knee flexion. So people involved in sports such as gymnastics, wrestling, martial arts, even ballet dancers may notice this knee flexion weakness beyond 90 degrees of knee flexion, so they may want to consider another type of graft. With regard to allograft tendon, there are many studies that show that patients under the age of 40 have a higher risk of graft failure when using allograft versus autograft. So in our institution, we usually just recommend allograft tissue for patients over the age of 40, or in other situations such as doing a revision ACL reconstruction where a desired autograft may have already been used and we can't use it again. Patients of small stature, low height, low weight, so low BMI patients, especially females, often don't have tendons that are large enough. For example, the hamstring tendons can be of small diameter and not very long. And even the patellar tendon may be too narrow to use. So in this type of patient population, we're starting to use more and more quadriceps tendon as a graft because we can better achieve a reliably sized graft from that source. And so there are some studies to show that patients with generalized ligamentous laxity or loose ligaments may do better with a graft such as a patellar tendon autograft than hamstring tendon autograft. And finally, immature adolescents or patients with open growth plates. And that usually means males under the age of 15 or 16 or females under the age of 13 and 14 should not be using a graft that has bone blocks attached to it, such as the patellar tendon graft or quadriceps tendon graft with a bone plug attached, because this can result in growth abnormalities, because the tunnels that we drill to place the graft go across the growth plate. So we have a piece of bone bridging across the growth plate. It can result in a growth disturbance.